Okay, now watch a quick talking about the respiratory systems, the symptoms for common diseases.
Upper respiratory infections are among the most common illnesses that people experience, and chances are you've dealt with at least one this year. Whether it's a persistent sore throat, a runny nose that just won't quit, or that scratchy cough keeping you up at night, these infections can be downright frustrating. But have you ever wondered what causes them or why they're so common? Understanding the different types of upper respiratory infections can help you recognize the symptoms, know when to seek treatment, and even take steps to prevent them altogether, which is what we're going to cover in this video. So keep watching to learn more about the most common types of upper respiratory infections, including a few that you've probably never heard of before. Number 1. Common cold. The common cold, also known as nasopharyngitis, is a viral infection primarily affecting the nose and throat. It is the most frequent infectious disease in humans. It is caused by a variety of viruses, with rhinoviruses being the most common culprits. Symptoms often include sneezing, runny or stuffy nose, sore throat, coughing, and low-grade fever. The common cold is highly contagious and spreads through droplets in the air when an infected person coughs or sneezes, or through direct contact with infected surfaces. Recovery typically occurs within 7 to 10 days, without the need for medical treatment, although symptoms can be managed with over-the-counter remedies. Number 2. Sinusitis. Sinusitis, also known as a sinus infection, occurs when the cavities around the nasal passages become inflamed and swollen. This condition can result from a viral, bacterial, or fungal infection and can be acute or chronic. Symptoms of sinusitis include facial pain or pressure, nasal congestion, runny nose, fever, and headache. Chronic cases may lead to persistent symptoms lasting for 12 weeks or longer. Treatment options vary depending on the cause and severity, ranging from nasal decongestants and saline sprays to antibiotics for bacterial infections. Number 3. Pharyngitis. Pharyngitis is the medical term for inflammation of the pharynx, commonly known as a sore throat. It can be caused by both viral and bacterial infections, with the most common bacterial cause being Streptococcus pyogenes, which leads to strep throat. Symptoms include a painful, dry, or scratchy throat, difficulty swallowing, and in some cases fever and swollen lymph nodes. Viral pharyngitis typically resolves on its own with rest and fluid intake, while bacterial pharyngitis may require antibiotics for treatment. Number 4. Bronchitis.
Bronchitis.
Bronchitis is an
This is
inflammation
known
of
as
the
a
bronchial
bronchial
tubes, the airways that
with
carry air to your lungs. It usually results from a viral infection, but can also be caused by bacteria or irritants like smoke and dust. Acute bronchitis is characterized by coughing that may produce mucus, wheezing, chest discomfort, and fatigue. Chronic bronchitis, a condition included in COPD, involves a long-term cough with mucus. Treatment for acute bronchitis focuses on symptom relief, such as rest, increased fluid intake, and cough suppressants, while chronic bronchitis may require inhalers and pulmonary rehabilitation. Number 5. Tonsillitis. Tonsillitis is an infection of the tonsils, the two lymph nodes located on each side of the back of the throat. It's most commonly caused by viral infections, but bacterial infections can also be responsible. Symptoms of tonsillitis include sore throat, swollen tonsils, difficulty swallowing, fever, and swollen glands in the neck. The condition can be diagnosed through a physical examination, throat swab, or blood test. Treatment varies depending on the cause. It may include home remedies, antibiotics for bacterial tonsillitis, and in severe or recurrent cases, surgical removal of the tonsils. Number 6. Laryngitis. Laryngitis is the inflammation of the larynx, commonly known as the voice box, which can lead to voice changes ranging from hoarseness to complete loss of voice. This condition is most often triggered by viral infections, but it can also result from overuse of the voice, irritation, or bacterial infections. Symptoms include hoarseness, weak voice, or voice loss, sore throat, and dry cough. Laryngitis is usually temporary and resolves with rest and proper hydration. In cases where laryngitis is caused by bacterial infection or persists for more than 2 weeks, medical attention may be necessary. Number 7. Epiglottitis. Epiglottitis is a potentially life-threatening condition characterized by inflammation and swelling of the epiglottis, the small cartilage lid that covers the windpipe. The swelling can block the flow of air into the lungs and is most commonly caused by bacterial infection, though it can also result from burns, injury to the throat, or other infections. Symptoms include severe sore throat, fever, difficulty in noisy breathing, and difficulty swallowing. Due to its potential to obstruct the airway, epiglottitis requires immediate medical attention, and treatment typically involves antibiotics and, in severe cases, securing the airway. Number 8. Croup. Croup is a respiratory condition that is characterized by a distinctive barking cough, which is often compared to the sound of a seal's bark. It typically affects young children and is caused by a viral infection that leads to swelling of the larynx and trachea. Symptoms include a barking cough, hoarseness, fever, and in severe cases, difficulty breathing with a high-pitched whistling sound known as a stridor. Croup is usually mild and can be treated at home with cool mist humidifiers, hydration, and keeping the child calm. However, severe cases may require medical intervention, such as steroid medication to reduce airway swelling or breathing treatments. Number 9. Influenza. Influenza, commonly known as the flu, is a viral infection that attacks the respiratory system, including the nose, throat, and lungs. Unlike the common cold, the flu can lead to severe illness and life-threatening complications, especially in the elderly, young children, and those with certain health conditions. Symptoms are more intense and include high fever, chills, muscle aches, cough, congestion, fatigue, and headaches. The flu is contagious and spreads through respiratory droplets. Vaccination is the most effective way to prevent the flu, and antiviral drugs can be used to treat it, especially if they are started within the first 48 hours of symptom onset. Number 10.
Trải nghiệm đặc biệt cùng mức giá khác biệt, trả góp 0% đến 12 tháng, ghé Sophonet ngay. Trải nghiệm
Whooping cough. Whooping cough, or pertussis, is a highly contagious bacterial infection of the respiratory tract caused by Bordetella pertussis. It's characterized by severe coughing spells that end in a whooping sound when the person breathes in. The cough can last for weeks and is more severe in infants and young children. Other symptoms include runny nose, nasal congestion, and fever. Vaccination is the best prevention against pertussis. Treatment typically involves antibiotics to reduce the infection's duration and severity, and hospitalization may be necessary for infants and those with severe cases. Number 11. Adenoiditis. Adenoiditis is an inflammation of the adenoids, which are small pads of tissue located at the back of the nasal cavity. This condition is common in children and can be caused by a bacterial or viral infections. Symptoms of adenitis include nasal congestion or blockage, ear pain, difficulty breathing through the nose, snoring, and recurrent ear infections. Since adenoids help filter out bacteria and viruses from the air, their inflammation can lead to a decrease in the body's ability to prevent respiratory infections. Treatment for adenoiditis may involve antibiotics for bacterial infections, nasal steroid sprays, or in chronic cases, surgical removal of the adenoids. Number 12. Tracheitis. Tracheitis is a rare but potentially severe infection of the trachea that usually occur in conjunction with an upper respiratory infection. It can be caused by bacteria or viruses, with bacterial tracheitis being more severe and often requiring hospitalization. Symptoms include a high-pitched cough, difficulty breathing, stridor, and fever. Bacterial tracheitis is considered a medical emergency due to the risk of airway obstruction and requires prompt treatment with antibiotics and sometimes surgical intervention to secure the airway. Number 13. Scarlet fever. Scarlet fever is an infectious disease resulting from a specific type of Group A Streptococcus bacterial infection, often following strep throat or a skin infection like impetigo. It's characterized by a bright red rash that feels like sandpaper, fever, sore throat, and a characteristic strawberry tongue. Scarlet fever primarily affects children between the ages of 5 and 15 and is highly contagious. Treatment includes antibiotics to prevent complications, relieve symptoms, and reduce transmission to others. With treatment, the rash and other symptoms usually improve within a week. Number 14. Diphtheria. Diphtheria is a serious bacterial infection caused by Corynebacterium diphtheriae, affecting the mucous membranes of the throat and nose. Although it's rare in countries with advanced immunization programs, it can cause a thick gray or white coating in the throat, leading to difficulty breathing, swallowing, and potentially blocking the airway. Other symptoms include fever, chills, and swollen glands. Diphtheria is highly contagious and can be fatal if left untreated. Treatment involves administering diphtheria antitoxin to neutralize the toxin produced by the bacteria, along with antibiotics to clear the infection. Vaccination is key to preventing diphtheria. Number 15, respiratory syncytial virus. Respiratory syncytial virus, or RSV, is a major cause of respiratory illness in infants and young children, but it can also affect adults, especially the elderly and those with underlying health conditions. RSV infections can range from mild cold-like symptoms to serious lower respiratory tract illnesses, such as bronchiolitis and pneumonia. Symptoms include runny nose, decrease in appetite, coughing, sneezing, fever, and wheezing. In severe cases, hospitalization may be required for supportive care, such as oxygen therapy. There is no specific antiviral treatment for RSV. Prevention through good hygiene practices and monoclonal antibody prophylaxis in high-risk infants is crucial. But as previously mentioned, upper respiratory infections are a common part of life. But knowing the different types can help you manage symptoms, seek the right treatment, and even prevent future infections. From common colds and sinus infections to less familiar conditions like laryngitis, understanding these illnesses empowers you to take better care of your health. Stay informed, practice good hygiene, and consult a healthcare professional when needed. The more you know, the better prepared you'll be to breathe easy and stay healthy year-round. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Have a nice day, and thanks for watching.
Can you just watch very useful video clip? The top 15 types of upper respiratory infections. What about others more serious disorders related to the respiratory tract? Lung cancer and pneumonia. And find more information about this disease in the following clips.
Today's topic is pneumonia. Pneumonia is an inflammatory condition affecting the air sacs in one or both lungs, most commonly due to an infection. The air sacs are called alveoli and may fill with pus or fluid, making it very difficult to breathe. Many germs can cause pneumonia, but the most common are bacteria and viruses in the air we breathe. Pneumonia affects approximately 450 million people globally, resulting in about 4 million deaths per year. Pneumonia may range in seriousness from mild to fatal. It is generally more serious when it affects older adults, infants, and young children, those who are critically ill, and those with a weakened immune function. Although it can occur at any age, pneumonia is more common in elderly people. Pneumonia can result in complications such as sepsis, lung abscess, and pleural effusion, or fluid accumulation around the lungs. Types and causes. The major types of pneumonia are classified according to the types of germs that cause it, where the infection was acquired, and how the infection was acquired. Types of germs. Bacteria. The most common cause of bacteria pneumonia is the Streptococcus pneumoniae. This type can occur on its own or after a cold or flu. Chlamydophila pneumonia and Legionella pneumonophila can also cause bacterial pneumonia. Viruses. This is usually caused by respiratory viruses, such as those that cause colds and flu, especially in young children and older people. Viral pneumonia is usually not serious and lasts for a shorter time than bacterial pneumonia. Fungi. Fungi found in soil or bird droppings can cause pneumonia in people who inhale large doses of the organisms. This type is most common in people with chronic health problems and weakened immune systems. Mycoplasma. These organisms are not viruses or bacteria, but they have traits that are common to both. Mycoplasma pneumonia produces milder symptoms than other types of pneumonia. Types by location, or where the infection was acquired. Community-acquired pneumonia, or CAP, refers to pneumonia that is acquired outside the hospitals or other healthcare institution. It is the most common type of pneumonia. Hospital-acquired pneumonia, or HAP, refers to pneumonia acquired during a hospital stay. This type of bacterial pneumonia can be more serious than other types because it develops in people who are already under medical care for another condition, and because the bacteria involved may be more resistant to antibiotics. Types by how the infection was acquired. Aspiration pneumonia occurs when an individual inhales bacteria into the lungs from food, drink, vomit, or saliva. This type is more likely if you have swallowing problems or excessive use of alcohol or drugs. Ventilator pneumonia arises from being on a ventilator for respiratory support in an intensive care setting. Most kinds of pneumonia are contagious. Both viral and bacterial pneumonia can spread to others through inhalation of airborne droplets from a sneeze or a cough. An individual can be infected with fungal pneumonia from the environment. It doesn't spread from person to person. Anyone can be infected, but certain people are at a higher risk. People older than 65 years. Infants from birth to age 2 years. People with a weakened immune system. People who smoke, drink excessive alcohol, or use illicit drugs. People with chronic conditions such as asthma, diabetes, heart failure, cystic fibrosis. Symptoms: fatigue, a cough which may produce phlegm, chest pain while breathing or coughing, fever, sweating and chills, shortness of breath, nausea, vomiting, diarrhea, lower body temperature, especially in older adults and people with a weakened immune system. Diagnosis and treatment. The doctor will review your medical history and carry out a physical exam. During the physical exam, the doctor will listen to your lungs with a stethoscope to check for abnormal bubbling or crackling sound, which may be suggestive of pneumonia. If pneumonia is suspected, the doctor will recommend blood tests, chest X-ray, sputum test, urine test, pulse oximetry. CT scan and pleural fluid culture may serve as an additional diagnostic test for people who are older than 65, are in the hospital, have serious symptoms, or health conditions. Treatment. Treatment depends on the type and severity of the pneumonia, your age, and overall health. Treatment option aims at curing the infection and preventing complications. Treatment options include antibiotics, antiviral and antifungal drugs to treat bacterial pneumonia, viral and fungal pneumonia, cough medicine to calm a cough, pain relievers for discomfort and fever, such as aspirin, ibuprofen, and acetaminophen. If symptoms are severe, hospitalization may be recommended. Thank you for watching.
Pew 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 pew.
Lung cancer is the leading cause of cancer death worldwide. It makes up around 25% of the cancer deaths in the United States. Advances in managing breast, cervical, and prostate cancer have led to improved survival rates, whereas mortality from lung cancer has remained largely unchanged. For people with localized lung cancer, the overall 5-year survival rate is 63%. If the cancer has spread outside of the lungs to nearby lymph nodes, the 5-year survival rate is about 35%. And even the best reported 5-year survival rates for metastatic lung cancer are only 10 to 15%. The high mortality of lung cancer is a consequence of patients presenting late when the cancer has already metastasized. Around 80% of patients have stage 3 or stage 4 lung cancer at presentation, excluding them from a potentially curative surgical resection. A potential reason for the late diagnosis is that early lung cancer is largely asymptomatic. It takes around 8 years for a squamous cell carcinoma, for example, to reach a size of 3 centimeters when it is most commonly diagnosed. So by the time symptoms arise, the risk of metastasis is quite high. Also, once symptoms appear, they are often nonspecific, delaying the diagnosis and treatment even further. The most common early symptoms of lung cancer are blood when you cough or spit, recurring respiratory infections, an enduring cough that is new or different, pain in the shoulder, trouble breathing, hoarseness or wheezing, and exhaustion, weakness, or loss of appetite. Doctors may suspect lung cancer based on the symptoms. To know for sure, they will take pictures of the lungs. If the pictures show something that looks like cancer, the doctor will do a biopsy. A biopsy takes a sample of tissue from the lungs to send for testing. By looking at the biopsy sample under a microscope, doctors can tell whether their patient has cancer and what type it is. Once cancer has been identified, tests will be done to see if the cancer has spread to other parts of the body. These tests may include a CT scan, an MRI scan, and a PET scan. All this information is used to determine the stage of the cancer. The stage enables doctors to estimate the person's prognosis and to choose the most appropriate treatment. Surgery is a treatment of choice for lung cancer that has not spread beyond the lungs. Before surgery, doctors will do a pulmonary function test to determine whether the amount of lung remaining after surgery will be able to provide enough oxygen and breathing function. If the test results indicate that removing the cancerous part of the lung will result in inadequate lung function, surgery is not possible. Although lung cancers can be removed surgically, removal does not always result in a cure. Supplemental chemotherapy after surgery can help increase the survival rate and is done for almost all lung tumors. Sometimes chemotherapy is also given before surgery to help shrink the tumor. In metastatic lung cancer, the cancer cells have traveled from the lungs to other organs where they have formed new tumors. Both chemotherapy and radiotherapy may be given to improve survival. However, at this point, the disease is incurable. Small bits of the disease may linger in the body and cause a disease recurrence, even if the treatment appears successful. Thank you so much for watching this video. If you liked it and you want to see more of my educational videos, please consider subscribing to my channel.
Yeah.
My work is easy because I use
Right now, let's got the answers for Park C and Park D. Taxi, that's one. That's two. Rồi, tắt đi. Reading four. That's one. That's two. chemistry. That's 4. That's 5. Okay, that's the end for session 2. Prepare for session 3. The last session of chapter 10 at medical terminology of the respiratory system for the next lesson. Okay, bye bye guys. See you next time.
Bye bye cô.